This program is brought to you by Emory University.
The way I see PTSD, or Posttraumatic Stress Disorder, is that people are haunted by something that happened to them in their past. So that haunting nature comes out in what we call re-experiencing symptoms, like nightmares, flashbacks, thinking of it when you don't want to. When you do think of it, it throws you off kilter, it's upsetting. Also, avoidance symptoms. So in general, people don't like to talk about it, they don't like to think about it, they don't like anything to remind them of it. A lot of times people will feel physical hyperarousal symptoms. That comes out in problems sleeping, problems concentrating, being irritable or angry, being easily startled. So if you have all of this and it's interfering with your functioning, you might have PTSD. A lot of family members will complain, you're not like you used to be, you're not the person you were before. For some people, they're having difficulty making little decisions like what toilet paper to buy. So if this is happening to you, and if you feel like you're haunted by something that happened in your past, especially if you thought you'd be killed or seriously injured, then you might be having problems from PTSD. We think of PTSD as the war veteran's disease, and it is a huge problem in the war veteran population. But we see PTSD following rape, following motor vehicle crashes, following earthquakes and natural disasters. In general, about 10% of people at any time are going to have PTSD. So it really is a huge public health problem. It's not just the war veterans disease. PTSD is a lousy problem to have because it means that you went through something that was probably life-threatening or very scary, and it means it's really still interfering in your life now. People have a lot of problems sleeping with PTSD. That messes up everything else. People have a lot of relationship problems when they have PTSD. People often have substance use problems, alcoholism or drug abuse, because they're trying to self-medicate. A large part of our homeless population, especially the homeless veterans, also have PTSD. Some people think that people with PTSD think about suicide more, maybe even commit suicide more. So it's a huge problem. They have more medical problems. They go see the doctor more, and there's a little bit of data showing that it really does adversely affect your health. So there are lots of reasons, if you think you have PTSD, to get checked out and to get treatment for it. If you have PTSD, it's a hard disorder to live with. If you're living with someone with PTSD, it can almost be just as painful because you see that they're not the same person that they were before. You can see them not sleeping. They can feel very distant from you. A lot of times folks will get to us because of a loved one will call us and say, I think they've got PTSD and I think they need treatment. There are a number of resources. We have a website, braveheartveterans.org, in which you can find out if you or someone you love might be suffering from PTSD, and also get some resources nearby to get hooked into treatment or an evaluation. PTSD first came about as an official diagnosis in 1980, and that was really in response to the large number of Vietnam veterans with PTSD. But we know all sorts of people can have PTSD from all sorts of experiences in which they thought they could be killed or seriously injured. The bad news that I give somebody is you have a PTSD diagnosis, because it's a lousy way to live. The good news is we do have lots of good treatments that we've developed in the past 20 or 30 years. There are 2 medications with an FDA approval for PTSD, sertraline or Zoloft, paroxetine or Paxil, and those are very helpful for people. And there are other medications that have been shown to be helpful. What hands down seems to be the most helpful for people is what we call cognitive behavior therapy. And there are different forms of it, But what we do here at Emory, and what a number of people do around the country and around the world, is what we call exposure therapy. And that's helping people confront the memory of what happened and help them go over it and feel more comfortable with it and gain a sense of mastery over the memory. So we can never undo what happened. It will never even be a pleasant memory. It'll always be something awful, but it doesn't have to be so intensely painful. And we've had very good success with that. So that's the good news, is even if you or your loved one has PTSD, there are good treatments for it. The general treatment with the most evidence for its efficacy for PTSD is called exposure therapy. And that's where we help people go back in their mind's eye and go back to the time of the trauma and recount it over and over to be able to get a sense of mastery over it, to be able to look at it differently, to feel a little bit more comfortable with it. What we've been doing in the past few years is also doing exposure therapy, but using virtual reality. So virtual reality is a multimedia, computer, interactive environment, but it's more than that because the user experiences a sense of presence in that environment. We use a head-mounted display that has two little television screens in front of each eye. It's got earphones, it's got a position tracker. So just like when you turn your head in reality and your view changes, so it does in the virtual reality. People say within about 10 or 20 seconds of putting on this head-mounted display or helmet that becomes their reality. What we do is we have people go back in their mind's eye and describe their most traumatic experiences from Iraq or Afghanistan, and then the therapist is matching what they're describing in the virtual reality. So we have two scenarios we can use. We have a virtual Humvee that travels down a desert highway, or we have a city scene that looks like a Middle Eastern city that they can walk around different areas. So for example, if they're describing an IED hits in the front, we can explode an IED there. If they say everything's filling up with smoke, we can fill everything up with smoke. And the idea is to go over it and over it and over it until it becomes a little bit less painful memory, until you can think about it in a way that's not interfering as much with your life now. And we think that the virtual reality might add something for some people over regular imaginal exposure therapy, because it is hard to avoid. So the nature of PTSD is people want to avoid it and people want to not feel the pain. But I don't see any way to the other side of the pain except through it. And so we think you need to experience the emotions, and for some people it's very difficult, and we think that the virtual reality helps. In general, people with PTSD are very avoidant. In general, it's hard to get them to go there. It's hard to convince them this is a good thing to do, because they have set up their lives to avoid thinking about it, avoid anything that reminds them of it. So in general, this is a treatment that's hard for people with PTSD. I have seen probably hundreds, maybe even at this point thousands of people go through it. So I know, I've got the conviction that this is helpful, and that it's so helpful that it's worth asking people to go through the pain. For certain people, it's even more difficult for them to go there. I think for a lot of folks who served in the military, veterans or active duty service members, they are trained to cut off their emotions, to act as they were trained to act and not have a big emotional response. And in a war zone, that's a really good thing. Back here, when you're trying to put it all back together, it can be an obstacle that we have to surmount. And that's where we think that the virtual reality, a lot of people say the sounds are even more evocative even than what they're seeing in the head-mounted display. And I think it makes it harder to avoid and harder not to go there, and helps us break through that avoidance. For some people, there's stigma associated with PTSD and with having an emotional response. A lot of people think about that as kind of macho, but we will see it in men or in women, and especially folks that served in the military, that they feel weak or they feel like babies. And we try to tell them these are the invisible wounds of war. You wouldn't feel that way if your leg got blown up and had an amputation, because people can see it and understand that pain, and people don't understand this pain. And a lot of times even the people who are experiencing it. So it really does take courage to go through this treatment, and we don't use that term lightly. Courage is being scared and doing it anyway, and that is what this treatment requires.
The preceding program is copyrighted by Emory University.